Hey everybody, how's it going? I'm Dr. Kevin and I'm the director of Softwave here at Gate City Health. I first just wanted to say welcome. I'm so happy you're here and I can't wait to get you on your way to healing. But before we get started, I just need a couple of minutes of your time so I can explain to you how exactly Softwave works. So on my end for this first session, I use this device not only as a treatment for you, but as a diagnostic tool. So I'm going to cover the entire region of the problematic area that brought you in today. We're going to be able to determine where damaged tissue is together with just a little bit of discomfort. So you guys normally explain it like a deep rubber band snap. But I tell all of my patients, you got to feel it to heal it, okay? So I want you right around a 6 or 7 out of 10 when it comes to that discomfort. Now you might be sitting there thinking, well, doc, I got a couple different things going on here today. That's no problem. We'll be able to talk about each concern of yours in just a couple minutes when we're face to face. But let me get into the fun stuff on your end. First, we're immediately reducing a significant amount of inflammation to the damaged tissue, and we're starting a strong, constant healing cascade that's going from the brain to the body. So I don't expect all the pain to be gone after this first session, but you should feel a good change. Most of my patients say they have a noticeable decrease in pain, better range of motion, or a shift in the way things are feeling. But keep in mind that these changes are temporary after this first treatment. Super, super important to remember that these treatments build off of each other, and consistency is the key in order to get the best repair possible. Next, we're going to be having a substantial increase in blood flow to the area. That's going to help to promote healing, healthy tissue by getting more oxygen and nutrients into that tissue in order to rebuild. And then, of course, the third thing, the stem cells. So let me piece this part together for you. Our stem cells grow, adapt, and they're recruited from our bone marrow. What Softwave does is sends a specific signal into the body to start to build local dormant stem cells. So with each treatment, we're building an army of hundreds of thousands, if not millions of these cells. But even more importantly, in my opinion, is we're setting a migration pattern, which is just one of many things that separates Softwave from any other device. Now, in order to better understand this migration, I always compare this to stem cell injections that we hear about all the time. So those injections actually have a much lower percentage of taking to the damaged tissue in comparison to how successful Softwave is. The reasons are sometimes those cells are taken from an outside source and our body does exactly what it's supposed to and rejects them. The other reason though is if that injection isn't at the precise location required, those stem cells can't find the necessary damaged tissue that needs repair, they get exhausted and we end up excreting them. Softwave has a much higher success rate for repairing this damaged tissue because one, I'm building your own stem cells, so they're all family in there. But even more so, when we stimulate that damaged tissue, we set a flag. Every time we do a treatment, we're getting that flag bigger and more apparent to the cells. So come towards the end of treatments, they have an abundance and they know exactly where to go in order to repair that tissue. It takes about 8 to 12 weeks to get that full repair in there. So if we were to take the traditional route in managing chronic pain with medications, scans, injections, surgeries, not to mention lost time at work, the average American spends around $20,000 to $40,000 a year. Softwave is not only less than 10% of that annual cost, but again, we are not just taking care of symptoms, we're actually getting repair to that damaged soft tissue. All right, guys. The treatment is only about 5 minutes long. Afterwards, I'm gonna have you move around in certain positions and certain motions that were giving you problems, and we should feel that change right away. That's gonna be able to help determine for me if you are a candidate for Softwave, which I can tell you now, 80% of the population are. So I'm really excited to get started. If you have any questions, hold on to them, and we'll answer them in just a minute in the back. I'll see you guys soon.